Well, good morning and thank you again for coming back. It's Tuesday, the 25th of February 2020. Now, I was listening to the World Health Organization yesterday, and they do say that they're concerned about cases outside China, but it's not yet a pandemic. Now, basically, I think these statements have just now lost all credibility, so I'm not going to dwell on it. You know that silly saying about ducks, it looks like a duck, walks like a duck, quacks like a duck, probably a duck. This is a pandemic that we are now in. There is no ambiguity, in my mind at least. Now, a few points in the news that have caught my attention. Tenerife. Italian tourist who was a doctor tested positive in Tenerife, the Canary Island, Spanish territory. He was from Lombardy, northern Italy. Now, this is concerning because he'd stayed in the hotel for a week with his wife. So he'd been in this hotel for a week already. But he'd been feeling unwell for several days when he reported to healthcare providers. Tested positive for COVID-19. Now isolated in a clinic in Tenerife, which is good, but 1,000 people in the hotel are now locked down. We don't know for how long. And the hotel is surrounded by police to stop people coming or going. Now, a hotel is very different from a ship. You've got balconies, you can open the windows. But it still concerns me that there's 1,000 people in a relatively small area, given the transmission characteristics that we know this virus now has and the transmissibility we know this virus has. Presumably the staff are moving around the hotel to deliver food and things like that. So if I was in that hotel, I would be pretty uncomfortable. Let's hope the Spanish authorities have learnt a lot from the Diamond Princess debacle. Let's hope so. That's the situation there. Now, Italy. Now, this outbreak in Italy, they still haven't found patient zero. The index case isn't known. So they're not able to trace the epidemiological underpinnings of this outbreak, which is concerning. But there are now 229 cases as of my data. There's been 7 deaths, which gives us a death rate of 3%. Now, given that this has only been in Italy for a few days, we're still in the first week of the outbreak in Italy, that concerns me. 3% in the first week is a lot, because complications typically occur in the second week of this infection, as we've looked at from the case studies, from the published medical literature. And 30% are described as being critical, which presumably means they at least need oxygen support, and that's 13%. So 13%, if we get a lot more cases, is going to make healthcare provision challenging. And if there's a lot more cases in any country, it's going to make healthcare provision impossible for everyone. Difficult decisions are probably going to have to be made. So that was the main figure that concerned me from Italy, 13% of patients critical after the first week. And what we know about the natural history and the evolution of this disease, I would expect that to go up really quite significantly. Now, moving on to the situation in Iran in America. Now, one of the things that's humbled me really about this is people from different parts of the world are emailing me with on-the-ground information. And indeed, sometimes at personal risk to themselves. So I just recognise those people. Now, I do know who some of them are, but of course it's confidential. So this is official from Iran anyway. 66 dead, 66 infected, 15 or 50 dead, depending on if you believe the government or one of the ministers. These numbers, of course, I believe to be gross underestimates. The virus seems to have been present for 3 weeks in Iran. The schools are closed, public meetings are banned, border with Iraq is closed, and there are rumours of cases in this prison. Now, institutional spread has always concerned me. If this gets into prisons, hospitals, institutions where people are, living close next to each other, that is a concern. So that's quite a big concern, that a prison could become a new cluster or epicentre. Now, these places here, this is not on the official news, this is from my contacts. I don't know these cities, look them up on a map by all means, but that one's a long way from Coombe, that one's even further from Coombe, and that one's a long way from Coombe. So what we're seeing is spread within, well, we're talking about an over 800 kilometre radius from the epicentre, from Coombe. And there's new infected patients in these places in Iran as well. There's limited organisation and insufficient equipment. And this just beggars belief. The shrines in Coombe and Mashhad are still open, so people are still coming and going to these religious sites, which is, yeah, it's just ridiculous. Never mind. The authorities haven't closed these sites. There's a shortage of masks and disinfectants all over the country. So we are seeing a spreading picture there in Iran. Wide area. We're also seeing at least the threat of institutional spread, which is a bit frightening. Hong Kong, all the schools are closed for another month, at least another month. Now, South Korea. Again, what we have to remember here is the outbreak is young. 977 confirmed, but a week ago I think there was about, well, virtually none, below 10. So this has all happened in the past few days, dramatic increase. And even though it's the first few days and we expect the deaths to become more common later on, it's still 0.9% death rate in the first week. Now this is concerning. And the other thing about South Korea is the data here, I believe, is completely reliable. I trust the South Korean authorities to quite a high degree, and I believe these numbers. So 9 deaths from 977 confirmed cases in the first week, 0.9% is concerning. Because unfortunately, from what we know about the natural evolution of this disease, more of these are going to go on to die next week and the week after. South Korean citizens are refused entry to many countries. 1,600 more beds are being prepared in Daegu, which was the epicentre. And this is also concerning. A total of 2 patients are requiring medical care, 14% on ventilators, but 14 and 6 give us 20, so 20 related to that number there gives us about 2%, just under 2%. Or around 2%. So now this is concerning because this is in the first week. And again, we know from the natural history of this condition, from peer-reviewed publications that we've reviewed in past videos, that the complication rate is higher in the second week. So again, I'm afraid I expect more of these people to become critical and require significant care. And again, 14 on ventilation, that is, I mean, a ventilated patient takes an awful lot of medical and nursing management. Typically, you'll have a team of doctors visiting several times a day. You'll have one-to-one nursing with an intensive care trained nurse. It's a very specialist field. It requires a lot of training. And of course, we haven't got that many of these people, and we haven't got that many ventilators. So if a lot of people need ventilated, it's simply not going to be possible to do it all at once. Now, China I'm going to come back to. Just finish off briefly here. The UK, my Minister of Health is very worried, which is his job to be worried, so good. Mayor of Manchester said we should prepare for the worst. Now, the US, the Centre for Disease Control, has raised its alert level. Avoid unnecessary travel to South Korea due to widespread community spread. So the American Centre for Disease Control is saying there's widespread community spread in South Korea. Now, I want to read you something from China. It's an email I've got from China this morning. Again, no names. I can confirm that Beijing has been under effective lockdown since January. The city normally gets quiet during the Chinese New Year as everyone goes back to their home and towns after the holiday. But the return to life that usually occurs a week afterwards has never happened. Now, Beijing, this is like saying New York or Tokyo or London. This is the thriving metropolitan centre of the whole country. So just imagine that happening in London or New York or Berlin or some other major Paris, some major city like that. All of the different apartment buildings have become like little castles which let no outsiders in and are protected by temporary walls. These temporary barricades have gone up all across the city, funneling all pedestrians through only a few checkpoints where people measure your temperature with little infrared guns. If you go to the supermarket, you will get checked once when leaving your apartment area, once when entering the market, and once when returning to your apartment. This is happening all across the country. If you live in an apartment, the local party officials of your neighbourhood give you little paper passes that let you come and go. Without those passes, you cannot enter the building. So all social visits are paused. The schools are closed and will remain closed indefinitely, as are most of the stores, aside from supermarkets and pharmacies. Most education is being done online at home. Most people who can work at home are working at home. Restaurants and bars are either closed or have seen a 95% plus reduction in traffic business. For now, everyone is really trying and doing everything they can. I don't think the general public of any country could do more than what the Chinese people are doing right now. So if you live in London, just imagine London being closed down like that, or any other major city. And these strategies are working. The increase in rate in China is reducing. There's still more cases coming every day, but the rate of increase has dramatically slowed down. So the Chinese are buying us time, still in many areas, to prepare for this outbreak. But data from other areas where we have now good data, like Italy and South Korea, concern me both in terms of the death rate in the first week and the number of patients requiring medical intervention, sometimes intensive medical intervention, only in the first week. And there will be more cases in the second week. And if this happens to several thousand people at the same time in any English city or American city, difficult decisions are going to have to be made.